Hello, everyone, and welcome to the first in our series on the Healthcare Spotlight series. We're going to talk about referral management today. That's going to be our focus. Before I invite the two panelists to join the conversation, just take note of the dates that are of our other in the series that we're going to go through, which we believe are key functional areas that are prime candidates for digitisation and automation. So, welcome, and let's continue with the rest of our panel. I'd like to have a quick introduction to Leanne and Nalika from Data Capture Experts. Good morning, good afternoon. How are we? Good.
Thank you.
Be- uh, just by way of introduction, I'm Mark Hawthorne. I'm Enterprise Sales Manager at Kofax. I've been in, I suppose, business process automation for about 20 plus years. It's something that I'm passionate about. When I've come to Kofax, I've been at Kofax for 2.5 years, and one of my focuses is in the health sector. And to help me with that focus, I've asked two specialists from Data Capture Experts to join me today in the conversation so that we can have a bit of a better understanding, have a bit of an overview, and obviously dive into a little bit maybe of the technical aspects of referral management and the process and the opportunities for improvement. So, to introduce, Nalika, can I ask you to give me your quick introduction, and then Leanne, I'll ask you to do the same shortly after. Nalika?
Thank you, Mark. My name is Nalika, Chief Technology Officer at Data Capture Experts. My background is technology, but over the last 10 years, I worked with public and private healthcare settings with their digital transformation journeys.
Excellent, excellent. And Leanne?
So I am part of the Data Capture Experts team as an account director, but I have worked for 25 years in the healthcare sector itself. So I began my career as a medical laboratory scientist working in pathology, and then moved into more administrative roles within hospital services. So a number of years as project managing, director of a cancer service, and then clinical transformation. So over that time, lots of experience and exposure to service development as well as digital projects.
That's fantastic. Okay, well, I'm very much looking forward to going through these conversations and obviously further conversations in the Spotlight, the Healthcare Spotlight series that we've outlined earlier today. If we could just move on now and let's get into the nitty gritty of why we're here. We're here to talk about the referral management. I've actually put this slide up just for I suppose, a start introduction to give people a bit of a visualization of the referral management process. Now, this to me is a typical kind of view of a either a specialist clinic, specialist surgery operations, and obviously this would be someone sitting in the background there and capturing that kind of referral information. Now, Leanne, I'm going to ask you to sort of give us a little bit more detail I suppose, the process that is classically involved in the referral management, and then we'll sort of broaden out the conversation of where the opportunities are. But if at all, could you just give us the brief of what is involved in referral management, generally speaking?
Yep, absolutely, Mark. So that picture is a really, really classic picture of any kind of doctor's office, of any clinics, and so referral, I guess it's important to note the referrals really drive healthcare in whether you're coming into a hospital, whether you're coming into a private specialist rooms, a community nursing program, an allied health program, all the way that a patient gets there is via a referral. So referrals sort of are really very, very key to driving all of the processes that happen and all of the services that patients need to receive. And an office like this is a really classic example. So those referrals come into a specialist service by a number of different ways. So they might come in through a digital system if you're really lucky. They might come in via email. They will come in through fax. And and sometimes they'll still come in as hard copies because we still get paper referrals come into a lot of these services.
Yeah.
So all those different styles of referral are being sent into a service. They need to be brought together so that they can be centralised, so you can actually work through them or make sure that that you've got a process that goes through all of these next steps. So the first step really is an administrative triage. So the admin staff are generally looking at that referral to make sure that it has the right information on it, that it's a service that is provided by that centre, and to work out which clinician it needs to go to for a clinical triage, or which clinician's likely to see that patient.
Yeah. So
And
it
then the
sounds
second,
like there's still that manual kind of, even though you rattled off all the digital kind of, email and things like that, still sounds like there's a bit of a handover, isn't there? Like there's an interpretation that the team have to do. So it's not really automated, even though it comes in digitally. Is that a fair statement?
that's absolutely fair. And look, there are plenty of services that receive things digitally and then print a hard copy, because the
Wow.
process that they might use on their desk, as you can see in that picture, is actually a paper-based process. So the process might require a hard copy to move through each of those steps to get to the appointment being made. So
Yeah.
the
So
second
it's
step
yeah.
is a clinical triage, and so the doctor or the allied health or the nurse are reviewing it and deciding on the priority. So that priority then dictates whether or not you need an appointment in 3 days, in 3 weeks, 3 months, 6 months, whatever it might be. And then the third step is that referral goes back to admin again for those appointments to be made. So the appointment gets made, or the patient might be waitlisted if it's going to be quite a ways off. So you've sort of got 3 steps before the patient knows what's happened. And so all
Yeah.
the while, this could have taken a week, 2 weeks for all of that to occur. You may have a doctor in particular that only comes to your service once a fortnight. So the referral's waiting for his clinical triage, maybe sitting in a tray, waiting for that next fortnight to roll around. So that can take
Right.
some time. And then really the fourth step is going to then be communicating back to the patient. So the patient knows that their referral's been sent in, but they don't know what's happened to it in amongst all of that time. So the patient sitting patiently at home waiting to find out. So then the admin staff typically are then either communicating with the patient in some way, whether it's by phone or by sending them a letter or an email to let them know when their appointment is going to be. So there's a number of steps, and all of that requires all those bits of paper, all those different referrals and different media to move through the process together.
Yeah, yeah, that's extraordinary. My head's spinning. I don't know which question to start off with first, but um, Nalika, in your sort of background, especially the technical background that is your role at DCE, where do you see some of the, I suppose, major opportunities for I don't know, digitizing the referral management process and making it a bit more, I don't know, a little less handover, a little less gaps with people having to actually do some manual sort of interpretation. What are your thoughts, or what have you been doing in the health sector in that regards?
Yes, Mark. So the current state for a lot of health service providers when it comes to referral management is largely paper-based and manual and fax. And and this is where the technology can come in to streamline that process, um, and centralize that process. The more you centralize a process like referral management, there's a lot of efficiencies and effectiveness of how you process a referral from end to end. So one of the thing that we want to do is that when a referral come, often referrals come with some sort of service request for some services, and to meet the requirement, obviously the referring team need to be onboarded into the referral management system. The referring team need to be organized by their specialties, by their teams, so that the admin triage team can route that referral and allocate that referral to the right area. and and there are a lot of other manual repetitive tasks that the admin teams that need to do, often at the forefront of this process. One of if I would give you some examples, things like the sending the letters, appointment letters, and notification back to the referrer, and notification back to the patient. They are all largely manual tasks at this point, or things happen over the phone lines and phone calls, and often things like sending the appointment letters. So so the technology today allows us to automate some of these manual and repetitive things, and really helping the process to be more digitalized and centralized, so that the referral can be processed and go through and take quite quickly and efficient manner.
So, if I can just summarize that, you're saying there's an approval opportunity that we can digitize, right? So that we can have people actually involved in depending on skill and maybe security and what have you in that kind of workflow, so that people are actually connected, I suppose, to a process. So there's obviously some efficiency gains there, so that we make sure that things are getting routed to the right people, right? So there must be a benefit there and that kind of stuff. And then that one of actually doing the booking and making sure that, that the calendar kind of concept is actually happening as well. So there's obviously a benefit there. So already, just with two handovers, you've actually digitized very quickly from a workflow kind of capability and that kind of respect. Leanne, I might ask you a question here. When it comes to the information that is on that referral, how is that kind of, I suppose, in my definition, allocated, reviewed? How's that kind of happening in that way, and how do you see that getting digitized?
Yeah, so referrals generally contain all very similar information. It might not be in exactly the same format, but it is all very similar. So there's always who the GP is referring to, or who the referring doctor is referring it to. So sometimes it's a name, sometimes it's a service that they're referring to. They're always referring, they need to give a provisional diagnosis. So what is it that's wrong with this patient that means
Right.
they need to be seen? And what other clinical information, I guess, can be provided to help support that ongoing care, or that diagnosis to be made. So, and as well as all of your key information like your demographics. So all of the patient details need to be there. The referring doctor details need to be there. And so all of those pieces of information are typically somewhere on that paper request form. They might just be in different spots. So it's a bit about going through what are those key pieces of information that we're going to need once they're inside the service. So which will be demographics, it will be the referring doctor's details, it will be the service that they're being referred to details, and sometimes a little bit of information about what they're being referred for. Is it for a treatment? Is it for an assessment? Is it for a further diagnosis or a surgery or something? So those are the key pieces of information that we want to collect and standardise, and then that's what we use throughout the system to actually manage the patient.
And stating the obvious, this is something that data capture experts do for a living, is it? It's sort of like where your skill set, the systems and automation that you guys apply, using Kofax as one of your technologies and so forth. Is there, Nalika, there's a buzzword that kind of goes around that sometimes isn't always understood, and it's called intelligent automation. Now, we that seems to be a bit of a broad stroke kind of statement. Is there something that you can help the audience maybe understand your definition of what intelligent automation is and how it applies to referral management?
Yeah, sure. Um, First of all, modern day referral management systems cannot be a standalone. It need to be integrated to a number of backend systems the health service provider has, as well as external systems. To give you some examples, often referral management systems need to be connected to the patient administration system via HL7, so that when a referral comes, it has a context to that, and to look up the patient and check what other appointments are already being made or what yet to be made, things like that, and
Okay.
eligibility checks, things like that. So that is where the intelligent automation can come in. And the integration is a core aspect that we need to establish, and on top of the integration, it can bring a lot of benefits of automation. Now, Leanne earlier referred to the referrals are unstructured, so semi-structured documents. Most referrals are document based, and some of these referral carry information, some information which are critical to drive that workflow, such as identifying the criticalness of a referral based on what's been written in it. So, intelligent automation and AI and machine learning technology these days can be applied for the context and the content of that referral and prioritize that in the queue, because it has enough knowledge of the understanding of the patient's context, by referencing the past systems as well as what's contained in the information, which can be allocated to the right area. And some of the when the health service is large, obviously often there are a lot of teams that specialize on certain activities. So there's some sort of routing and rules that we can embed into the system itself, so that it can be routed quite quickly to the right place where the clinical triage can take place. So I think those are the opportunities for us to use intelligent automation technology, and make it smarter process rather than just a database-driven database, referral management database. And that's the real opportunity. And obviously, the cloud and security and single sign-on all need to come into place to make it more robust and scalable these days.
Thanks for that, Nalika. Leanne, a question for you. With the end user experience, like sometimes I feel like my experience when I'm talking with healthcare professionals, they love the manual piece of paper because that's what they're used to. It's something that they can touch, it's a bit more tangible. Um, how do you see that we can create, I suppose, an adaptive culture to take on these technologies and make them easier to use? Have you got a thought going on there, or have you had experience where maybe it isn't that much of a pushback and people are grabbing these technologies? Have you got an opinion on that?
Yeah, and look, I think it varies a lot, Mark. I think it does, it's very person dependent. So some people are absolutely um, jumping out of the gates wanting something digital to use that, and that's what's natural for them, and it's what they've been doing in other areas or other workplaces. So some people are very, very keen, and some people are not. Some people are a bit reluctant because it is different, and when it's on paper, they know the volume, they can feel the volume because they can see the pile of paper, they know what's going on with it. It's easy for them to quickly write something very small on the top of the piece of paper rather than have to open up an application and type into it. So the real keys to that are to make it user friendly. So as much as you can automate a workflow, so there are less clicks. Doctors always want less clicks. So the least number of clicks you can do and least amount of scrolling, so that they can see what they need to see on one screen, the
Yeah,
more likely you are to get buy-in from them. And they need to
yeah,
see the benefits. So they need to see that the benefit is that if you're sick today, you could still access the system from home and do clinical triage, or you could access it from one of the other work sites that you work at if you needed to. And they need to see that the timeliness and the care, which the timeliness, ultimately is about patient care. We want those patients to be seen as fast as possible. So the quicker we can do all these things, then the better patient care is going to be. And so those are the sorts of drivers that you want to be able to highlight to your clinical teams to show the benefits.
that's a great comment. I mean, it's all about trying to improve that patient care. I mean, there's time efficiencies, helping the admin staff to be quicker, faster, more responsive in their roles with those digital kind of frameworks. It's just there's plenty of opportunities here just in the referral management process, which is it just seems such a simple process, but it's extraordinary how many steps there seem to be in that process that are primed for automation. I really thank you, Leanne and Nalika, for your insights in that regards. I'd like to sort of summarize a little bit there on, I suppose, what I heard that we've got an important integration piece that we should always be looking out for as far as obviously multiple systems. There's source data and there's validation things that we can digitize, we can get going, and we can automate. Um, there's the opportunity for these things to be cloud-based, which obviously easier deployment, multiple locations, remoteness, and all that kind of stuff. So there's natural synergies and benefits in there. The workflow automation is an obvious benefit as far as being able to escalate, elevate, you know, I don't know exactly if referral management has any KPIs in there, but like if there are organisations or health professionals that need to want to keep an eye on their quality of service delivery, I'm sure that once you automate those workflows, you get a bit more visibility, a bit more
Absolutely.
dashboard kind of logic and workflow and things like that. So I really thank you guys for including me in this conversation and I'm looking forward to the next in our spotlight series. But just finishing up, I'm sure that we didn't, we did purposely didn't go through any product kind of details today. But Leanne, is there a method by which you can recommend or help people kind of either get this on the agenda with the executive team or putting a business case together? Is there some type of service or some type of thing that you can offer people in the audience or in general?
Yeah, absolutely. And look, contact us and to arrange a strategy session. So this is something that we can do is sit and work with you to understand where your gaps are, what the problem is that you're really trying to solve, and whether or not we have a solution that can do that. And then because I've written lots of business cases in the past, I can absolutely help with the sorts of things that you can include in your business case so that you can progress that change through your organisation. But contact
Excellent.
us is the best thing to do.
Excellent. We'll show that connection in a moment. All right. Well, then we might close off the session now and go into the fact of that consultation offer there is on screen. Please scan that barcode, email that link, and we'll actually organise an appointment for you. Like to thank everyone, Nalika and Leanne, for joining me in this conversation. Looking forward to the future in our spotlight series. Like I said, I think there's a lot more opportunities for digitization and automation in all of these processes. So please come along and join the conversation. And if there's any questions that we weren't able to address, please email them forward, and we'll actually make sure that we summarize those and get that back out to the audience from today. Once again, thank you very much for attending, and look forward to you being attending future in the Spotlight series.